This presentation is a part of a project on the recognition and prevention of potential upper extremity overuse injuries and risk factors within the Western North Carolina fly fishing community. This is part 2 of a 3-part video series, and this presentation is on elbow overuse injuries in fly fishing. So a brief overview of overuse injuries in general. Overuse injuries occur as a result of microtrauma caused by repetitive throw motion, which could be throwing a ball or casting a fly rod. This overuse or repetitive motion can cause micro tears and damage to the muscles and tendons that help you complete this motion. And some of the more common overuse injuries that are seen in fly fishing and other throwing sports are lateral elbow tendinopathy or tennis elbow, medial elbow tendinopathy or golfer's elbow, and triceps tendinopathy. So first, let's talk about lateral elbow tendinopathy. This is the most common overuse injury of the elbow. More than likely, everyone's heard of tennis elbow. Well, this is that condition. This is caused by injury to the extensor muscles. As you can see in the picture below, those muscles are on the outside of your forearm, and they are in charge of moving your wrist in a backward motion or into extension. Again, this is caused or typically characterized by pain on the outside of the elbow, and whenever you try to move your wrist into that backward position, activate those muscles, those will likely increase your pain. So now we're going to talk about medial elbow tendinopathy. So again, this is called the golfer's elbow. This is not as common as lateral elbow pain or tennis elbow, but it is still a common condition that you can experience. This is caused by the irritation of the muscles that flex the wrists and the fingers. So if you look down here on the picture, you can see that these muscles are on the inside of the forearm, and that would be where your pain is if you have this condition. And that pain would likely increase with wrist flexion or excessive gripping activities. And finally, we're going to talk about triceps tendinopathy. So again, this is less common than both lateral or medial tendinopathy, but it is something that can be fairly common in throwing sport athletes. Most people know where the triceps are, but if you don't, there's a picture over to the right side. It's those muscles on the back of your arm. And if you have triceps tendinopathy, this would be characterized by pain in the back of the elbow where the triceps tendon connects. And that pain would be increased by actively straightening the elbow or fully bending the elbow and putting the triceps on stretch. And again, this is typically caused by repeated elbow extension like we see in throwing sports or in fly fishing. So what can you do to help prevent an overuse injury? So if you suspect that you're developing an injury, try modifying your activity. Don't just do the same thing over and over again, because that's how these injuries develop. A big key for this is to allow your body time to rest. So if you're experiencing pain, if you're going fly fishing every day and you start to get some elbow pain or shoulder or wrist and hand, whatever it is, try to modify that activity. Try to take a day or two off and break up days in between your fishing to allow your body time to rest and recover. And if you're still experiencing pain after taking some rest or some time off or modifying your activity, you can contact your health provider or your healthcare provider to develop a plan to help treat that pain. Another thing you can do is staying physically active can help reduce your risk of injury. So it's not necessarily just going fly fishing every day. It could be walking, running, strength endurance training, anything like that can help reduce your risk of injury. And developing a warm-up routine prior to fishing can allow your body to adjust the activity and reduce your risk of injury. In the third part of this series, in video 3, is going to talk about wrist and hand injuries, but there's also a warm-up video that can give you an example of a proper warm-up routine that can help reduce this risk of injury. So some additional considerations. So let's talk about heavier versus lighter rod and reel setups. So obviously a heavier rod is going to cause higher stress on the body, higher stress on the muscles and ligaments responsible for or that are used during a casting. So if you can get away with using a lighter fly rod or reel, lighter line, lighter fly, any of that can help reduce the strain on your body caused by fly fishing. Another consideration is grip. So first of all, you want to have a comfortable grip, something that feels natural to you. You don't want to over grip the rod. So a lot of people have a tendency to really have a tight grip on the rod, and that can just cause unnecessary strain on your wrist, and your hand, your elbow. So that's something else to consider. And the grip size. If you find yourself not being able to get a comfortable grip, or just not having success with changing your grip or anything, try different grip size and see if that changes anything. And finally, having a smooth and fluid casting technique would really help reduce the strain on your body. If you have a violent casting motion, sudden starts and stops, stuff like that, that really increases the stress on your body exponentially. So having a smooth and fluid motion can really help reduce the risk of injury while you're fly fishing. And that's all for this presentation. The next presentation will be on wrist and hand injuries, and you'll see that in part 3.